Good afternoon, everybody. Many thanks for being with us today. My name is Ettore Greco. I am the Executive Vice President of the International Affairs Institute, Istituto Affari Internazionali. I am very pleased to open this hybrid seminar entitled Global Health and International Cooperation, Addressing Current and Future Pandemics. This seminar has been organized by our institute with the support and cooperation with Focus Quality, a member of Action Global Health Advocacy Partnership, and I wish to thank Focus Quality for cooperating so closely with us in the preparation and organization of this seminar. Indeed, it has been a major driving force behind the idea and the planning of this event. I think we are all aware then how to deal with pandemics and endemic diseases, not only COVID-19, but also such diseases as malaria, tuberculosis, and HIV remains an extremely topical and urgent issue. A complex, a daunting challenge that calls for enhanced international cooperation, the strengthening of the existing bodies and instruments, the creation of new ones, and also demanding and long-term commitments on the part of key actors such as the European Union, international organizations, but also individual countries. We know that COVID-19 has had a huge and multidimensional, far-reaching impact, including on economies of individual countries and the social fabric themselves, and has been exposing very much the weaknesses and vulnerabilities of many countries and regions that remain in fact very fragile and in need of badly in need of assistance and support by international organizations and major countries. I think the same can be said to different degrees to the other types of pandemics. The figures related to these to their developments remain very worrying. In the case of COVID-19 in particular, for instance, the level of vaccination remains very low in many critical areas and regions, and the mechanisms themselves that we have been able to create to fight against this pandemic, such as COVAX, are underfunded and are now being there is a debate on how to review this mechanism and how to reinforce them in view of the new challenges that we are witnessing, but also the performance of those mechanisms. Of course, multinational institutions such as G7, the G20, and the international financial institutions are key players. They have a special responsibility, but they also ultimately depend on the contribution from individual states. And we know Italy has been at the forefront in promoting global health cooperation, in particular during the last year, during the G20 presidency of Italy, has played a very important role and can certainly continue to make a considerable contribution in the fields. These are the subject of this seminar. So essentially the challenges ahead and what can be done to address them. And we will do that by presenting and discussing a brief report published by our institute and drafted by my colleague Daniele Fattibene. Of course, this report has been also intensively discussed also with our partner. And the report is divided into three main sections. The first offers an assessment of the state of play of multinational health cooperation in the fight against 19 specifically. The second discusses the impact of COVID-19 on the evolution of malaria, TB, and HIV. And the third provides some recommendation and proposal specifically targeted to the Italian government so that it can continue its action in support of developing global health cooperation in the fight against all those diseases. We have placed a special focus on the need that the global fund against HIV, TB, and malaria be replenished. That's a very important goal, so that it can operate effectively and be up to the current and the challenges that we can expect ahead. We should, of course, in discussing all those issues, take into account that there will be important events, future events, some upcoming, such as, for instance, the Global COVID-19 Summit, which will take place, I think, on May the 12th. So I very much look forward to our debate. I'm sure it will provide interesting inputs and also insights into those problems. So I have mentioned now the role of Italy and its responsibility, also as a member of the European Union. And I have now the great pleasure to give the floor to Marina Sereni, Vice Minister of Foreign Affairs, whose portfolio, if I'm right, includes specifically the role of Italy within the framework of international organization dealing with global health. So Marina, yes, please, the floor is yours.
Thank you very much, caro Ettore. Thank you. Dear panelists, dear participants, thank you for the kind invitation to intervene on global health and international cooperation, addressing current and future pandemics. We have read with much interest the report that is being presented today, its key findings, as well as its recommendations for Italy, to Italy. We are living in challenging times of multidimensional crisis. While the COVID-19 pandemic is still having an impact on strained health systems, on our lives and our economy recovery, several other pressing international emergencies are diverting political attention away from the COVID-19 pandemic. First and foremost, of course, the war in Ukraine. It is a tragic humanitarian crisis in the very heart of Europe, with the dire consequences also on health facilities in Ukraine. According to the latest WHO situation report, between the 23rd of February and 4th of May, 186 attacks have been reported to health facilities. These attacks deprive people of urgently needed care, endanger healthcare providers, and undermine health systems. The Italian government has promptly responded to the crisis by transferring 110 million euros to Ukraine as general budget support and 26 million to the main humanitarian organization of the UN system and of the International Red Cross movement and Red Crescent movement. In addition to the financial contributions, Italy has donated the 45 tons of humanitarian goods to Ukraine and Moldova, including 5 tons of health material, which were delivered to the Ukrainian Red Cross through the Italian Red Cross to alleviate the hardship of the war. Notwithstanding the tragic effects of the war in Ukraine, it is clear that the world cannot afford a lower attention on the fight against COVID-19. While the vaccination gap is progressively closing, much remains to be done in a number of countries where immunization rate still falls short of 10%. Many of these countries are African ones. Testing is dramatically insufficient in low and low middle income countries, with the consequence of having COVID-19 largely undetected. Italy is fully committed to peace as well as to continued engagement in the multilateral response to COVID-19. The Italian G20 presidency drew the roadmap for future action and it was mentioned by Ettore at the beginning. In particular, the G20 leaders committed to accelerate the vaccination campaign globally to reach 70% of the world population by mid-2022, that is tomorrow. Italy remains engaged to this goal, though we are still far from reaching it. So far, Italy has contributed to the multilateral response to the COVID-19 pandemic with 425 million euros and has made available to the COVAX facility over 70 million doses of vaccines for middle and low income countries. We fully agree with the urgency of equity. Although 480 million COVID-19 vaccines have been administered in Africa to date, making it the biggest vaccine rollout in the history of the continent, only 18.7% of the African population is fully vaccinated. Today, operational challenges are changing from a supply-driving approach to a demand absorption and capacity-driving approach. There is an urgent need to distribute the doses quickly and to increase absorption capacity of beneficiaries, transforming vaccine doses into actual vaccinations while fighting vaccine hesitancy. Italy is working on supporting vaccination campaigns by engaging with communities, influencing local groups and media, and training frontline workers. We intend to act in synergy with the ACT Accelerator and in close coordination with UNICEF and the Italian civil society organizations, given their critical role in immunization with COVAX and beyond. It is indeed in this direction that goes the recent Italian contribution to UNICEF's Humanitarian Action for Children appeal to support the activities of the ACTA Accelerator. This is an initial pilot contribution to support absorption rates in the countries most in need. As we work to accelerate COVID-19 vaccination efforts, it is critical to get the world back on track toward ending HIV, malaria, and TBC. Since 2020, these three epidemics have been negatively impacted by COVID-19, leading to a dramatic rise of cases again. In 2001, at the G8 summit in Genoa, the Global Fund to fight HIV, malaria, and tuberculosis was launched. Italy has supported the Global Fund since its inception and has invested over 1.2 billion euro in it. Italy looks forward to the upcoming replenishment as a moment to renew our commitment and collective action in the fight against these three diseases. The COVID-19 pandemic has shown that money spent on health should be seen as an investment and not as a cost. Sufficient, sustainable, and predictable funding are key to strategic planning in pandemic preparedness. We must focus on preventing diseases and not just treating them. The latest IPCC report sounds as an unequivocal alarm on the effects of climate change on humankind. Rising temperature and ecosystem depletion will increase the chance of zoonosis. I'm sorry, I don't read very well and I don't see the dot, you know. It's So, okay, glasses are not enough. Sometimes we need something more than glasses. The one, like youth, for instance, the one health approach is the only viable one. However, pathogens may still arise and we will still need life-saving innovations. Italy has recently pledged 20 million euros to CEPI at the recent replenishment. CEPI has played a crucial role in the research and development of vaccines against COVID-19, but also against several other widespread pathogens that affect in particular low and middle income countries. Finally, the G20 Joint Finance Health Task Force was established under the Italian G20 presidency with the objective to explore a new facility to achieve long-term adequate, sustained and effective financing of pandemic prevention, preparedness and response. In line with the Rome G20 leaders' declaration, achieving a broad consensus on an inclusive facility with the WHO at its center is key to its success, both in terms of effective implementation and as a prerequisite for its adequate broad-based financing. Thank you for your attention.
So much for for your welcoming remarks, both Ettore and Vice Minister Marian Sereni. I will now open the panel. My name is Daniele Fattibene. I'm researcher at the Istituto Affari Internazionali. Ettore and Vice Minister already anticipated some of the key issues that we will discuss today with you all. And let me say it's nice to see faces and people in presence for these events. I hope this is something that we will get used to do much more in the future. Let me also thank Francesca for letting this project a reality. We worked together a lot in the past weeks, and also thank you for facilitating the involvement of this very well distinguished panelist. So we constructed the panel in a way to address all the topics that Ettore has already anticipated in the welcoming remarks. So we wanted to have a look at what the state of the art is nowadays, after 1 year after the Global Health Summit, the G20, and the Vice Minister has already recalled this. The Italian presidency has put a lot of effort on this, and we are happy that the panel will also help us discuss the state of the art after 1 year. We will also discuss about the cost that the pandemic has had and on other epidemics, where we have seen decreasing performances, especially in fragile countries and sub-Saharan Africa countries, but also in other regions of the world. And we will also try to see what the perceptions on these new and the instruments that we can use for tackling future pandemics are envisaged by national but also international leaders. So I'm very pleased to introduce the panel to you. We will start with Françoise Vanny. Thank you for coming. Françoise Vanny is the head of the External Relations and Communication of the Global Fund to fight HIV, tuberculosis and malaria. And then we will go ahead with Director Francesca Manno. She's Director of the 7th Office on Global Public Goods and International Financial Relations, Director of the Ministry of Economies and Finance, Italy. We'll go ahead with Dr. Mohamed Abdulaziz, who is connected. He's the Head of Surveillance and Disease Control Division of the Africa Centers for Disease Control and Prevention. We are very pleased to have with us, unfortunately only virtually, Rosemary Mburu. She's Executive Director of the World HIV Campaign International, WOSI. And last but not least, we will have with us Professor Stefano Bella, a very good friend of YAI. Also, we worked together last year a lot on G20 and T20 on global health cooperation. And he's a young professor of global health of the Catholic University of the Sacred Heart. So I will address to the speakers one question, and I will give you a first round to intervene, and then we will go with a second round of questions. So I will start with Françoise Vanny. So my first question to you is, what were the costs of the pandemic on other existing health crises at a global level? The Global Fund has worked incredibly to raise the awareness and also to raise funding and the needed resources to tackle existing health crises and pandemics. So my first question to you is, what were these costs and what were the actions you took to, tackle them?
Thank you so much. Thank you very much for the invitation to Istituto di Affari Internazionali and Focus Equality for organizing this event. And thank you to all the panelists and to all of you for coming. So the question about the costs, I would start by saying that we don't know the cost yet, because the pandemic is not over and its direct and indirect impacts continue to affect particularly the most vulnerable around the world. So if we zoom in to understand what has been the impact of the COVID-19 pandemic on AIDS, TB, and malaria over the past couple of years, what we can say is that it's the first time in 20 years of working, as a partnership, as a global fund to fight and hopefully eradicate the 3 big pandemics, is the first time in 20 years that we've seen setbacks, that we've seen the programmatic indicators going backwards instead of going forward. So it's been a huge shock to the systems and to the programs in more than 120 countries where we invest. So how has COVID-19 impacted the fight against AIDS, TB, and malaria? It has disrupted programs in so many ways. Supply chains got disrupted. Community health workers were sick, overwhelmed, distracted from the fight against tuberculosis to deal with COVID. Not protected, they didn't have access to masks and other protective equipment. And then the patients themselves couldn't necessarily access the health facilities because they were afraid. They were told to stay home. They didn't know whether it was malaria or COVID. They felt discriminated against because it was so scary to be under lockdown. So for all of those reasons, the 3 pandemics we've been fighting for 20 years were very much affected. So going into a little bit more details, if we look at HIV, for example, the treatment, the antiretroviral treatments were maintained and actually increased during the pandemic. So that's the good news. Let me start with the good news. And that's thanks to health systems on the ground, community health workers, communities themselves, sort of taking their, how do you say that, their lives in their hands and just maintaining and ensuring the continuity of treatment. But when it comes to prevention and diagnostics, both have fallen very dramatically, which means that we expect to see infection rates go up in the coming months and year, because the prevention that should have taken place and the diagnostic that should have taken place have not taken place over the past couple of years as it should have. So we've gone backwards. In tuberculosis, we've seen also diagnostic going backwards and therefore treatments going backwards, including for multi-drug resistant TB, which is a very big threat to global security, global health security. And we've seen the death rate increase again. And in the case of malaria, the piece of good news is that the bednet distribution campaigns were able to continue, again, thanks to community health workers on the ground. But when the death rate for mortality rate for malaria has increased again. And as you know, malaria kills mostly children and mostly in Africa. So this impact is really, really dramatic. So when we started, when the COVID-19 crisis started, the Global Fund sort of, and not only the Global Fund, WHO and all the global health partners sort of saw that the impact was going to be very big on the rest of the diseases. So in other words, the indirect impact we knew was going to be even larger than the direct impact. So we obviously put in place all sorts of measures to mitigate such impact. So globally, we were part of the fathers of ACT-A, so the ACT Accelerator that was mentioned earlier, very much trying to bring together all the global health actors to join forces and make sure that we were coordinating our response and providing countries with all the tools that were available to fight COVID and to do that in an equitable manner. So we were part of that, and as of today, we have become the first channel of support to low and middle income countries for everything except vaccine. So vaccine obviously taken care of by our colleagues at COVAX, but we are the primary support channel for diagnostics, treatments, oxygen, protective equipment, and health system strengthening. So that's what we did sort of alongside our colleagues. And as Global Fund ourselves, we deployed more than $4 billion additional to countries to help them do the countries we support normally, to help them first mitigate the impact on COVID-19 on AIDS, TB, and malaria. Secondly, fight COVID through all those tools that we were able to help them get. And then strengthening health systems with the most urgent elements, whether it is supporting community health workers or lab strengthening and these sort of things. So as we speak, I think we have averted the worst case scenario. If you read back the WHO scenario at the very beginning of the COVID-19 pandemic, it was really forecasting doubling of death rates, for example. We have averted that worst case scenario, but we were not able to avert entirely the impact of COVID-19 on the fight against the three diseases, which means that as we speak, we've gone backwards, we've lost track of the 2030 target, in the sense that we are not on the right trajectory to end AIDS, TB, and malaria by 2030, which is our goal and the goal of the international community. And that what it will take for us to go back on that trajectory is going to take more resources and much more concentrated efforts in the coming years. So this is why in this context, we've launched our appeal for the 7th replenishment of the Global Fund. We've increased funding needs compared to last time around, an increase by 30%, and this is the result of COVID-19. So to the costs, and summarizing the response to your question, the costs are very significant, but we are still in the right moment to stop those costs from happening, to save lives and get back on track to the trajectory of the 2030 targets. Thanks.
For pointing out the fact that we're still on time, because sometimes there's a perception that these like epidemics or other pandemics that we're already facing are like lost battles, and it's not like that. So this is the right moment in which governments and decision makers have to intervene with proper resources to tackle current and future pandemics giving the same level of attention to all of them. I would now give the floor to Francesca Manno from the Italian Ministry of Economy and Finance. She has worked a lot in these years on these topics, and last year in particular, she has worked very much shaping the Italian G20 presidency agenda on these issues. And we know that one of the main outcomes of the G20 presidency by Italy last year was the establishment of this joint finance health task force, something which is always very hard to do, because working horizontally in national bureaucracies and institutions is always a big challenge. So my question to you is, what are, in your assessment, the main initiatives that were launched by this joint task force, and how can these initiatives impact the pandemic prevention, preparedness, and response?
Good afternoon to everybody, and I'm really very pleased to be here, and especially I appreciate the fact that the Istituto Affari Internazionali keeps the focus on the issues of responding to the current pandemic, but also on how to prepare for the future one. And the Vice Minister Sereni has already highlighted what Italy has done for the response. But addressing pandemic preparedness has been really a priority for Italy during our G20 presidency. In particular, my minister, Minister Franco, has been very vocal on the need to discuss among the finance ministers and others how to avoid the human and financial loss that the pandemic has brought about. And this was based on the conviction that during a crisis, we have really the momentum to make serious investments, both in terms of financial resources, but also in terms of changing the way the systems operate. And I really think that this pandemic has taught us really many lessons. On the positive side, they showed how the international community really rallied in support of research. We had the quickest vaccine in history, and also equitable vaccine and treatment deployment. On the less positive side, we have learned that reaching global consensus is not very, it's a complex matter, especially when it involves issues like global value chain, financial contracts, or patents. This is not easy. And building on a legacy of important initiative that Italy has spearheaded, I think about the pilot of the IMC or for the pneumococcal vaccine that we have spearheaded a few years ago, and also the traditional support to the health sector by the development cooperation in Italy. The work I think we have done during our presidency has clearly give Italy recognized leadership in this conversation, I would say. And of course, leadership comes with responsibility, and that's why we continue to press for a closer coordination and discussion on these issues, trying to avoid the pandemic fatigue that also the Ukraine crisis has brought about, and pushing for wider collaboration. And I really think this is very relevant today, today's world, in which decision should be really taken based on contribution by different disciplines. And the One Health approach is a clear example of this. And against these premises, just let me briefly outline, describe the work that the G20 Joint Task Force, Finance and Health Task Force, that was established during the Italian presidency and co-chaired by the Italy and Indonesia is doing. I believe that this task force really represents a unique place, because it brings together not only G20 health and finance representatives, but also regional organizations, global health actors, and financial institutions. And the scope of work, you can find it in the Leaders' Declaration of Rome last October. And the task force is basically set to do three things. First, it monitors and reviews the advancement of a global COVID-19 response, share experiences. We receive regular update from ACT-A and the multilateral leader task force. And this really helps the ACT-A to obtain visibility on its funding gap, sensitizing all of us G20 members on the need to invest in vaccine and medical countermeasure. I think someone said it, so it's been said several times, this is not charity, but really investment with a clear economic rationale, since it helps to rebuild the national, international activities. And I would like just to say that in the present environment that Vice Minister Sereni has described of, let's say, vaccine oversupply, as public policymakers, we really must prevent market failures and keep the supply environment healthy. But we also must safeguard the use of public resources by investing in a targeted manner. The second task is to propose a solution for pandemic prevention, preparedness, and response. And with the focus of two important aspects, governance and financing. And we are in a way carry forward the recommendation of the G20 high-level independent panels and many other panels that I think all of you here are aware. And if you are familiar with those work, you know that they really pointed their fingers at the lack of coordination among policymakers and of sustainable and adequate financing for preparedness function. So in sum, what they say that the PPR system was judged inadequate and heavily underfunded. So then what we want to do, and we will discuss this at the next, our next meetings at the end of May, is to try to see if we can put in place a structure and longer term collaboration among finance and health representative. And we are thinking of something along the line of the Global Health Board that you may recall our Prime Minister's mentioned during the first COVID-19 summit last September. So that's the final one is, of course, to explore the modalities to establish a new facility to achieve exactly this long-term adequate, sustained, and effective financing for PPR. And we will discuss how this fifth financial intermediary facility that may be hosted at the World Bank with WHO at its center would be a solution to finance PPR. Thank you.
Thanks a lot, Francesca Mano, for these remarks, and also thank you for helping us also with your colleague Gianmarco Cocozza on the revision of the study. We really appreciated your engagement and involvement in this process. I would now give the floor to Rosemary, who is connecting virtually. Rosemary has also supported Francesca and myself in the past weeks in drafting the report, and we really want to have a voice from the most fragile and vulnerable countries to this panel. So we had a very nice chat with you, Rosemary, in the past weeks. And what I would like to know from your side is to understand the cost of the pandemic on the most fragile and vulnerable communities. What were, in your opinion, the main direct and indirect costs that the pandemic brought in the countries you are covering with your program?
Thank you very much. It's a pleasure to be here and to be part of this panel. In terms of COVID-19 and the impact, which, as Francois said, we are still looking to see what the overall cost is going to be, but there has been quite a number of impacts that we have seen in terms of service disruption and also the economic impact. In terms of service disruption, we saw firsthand how different elements, including HIV, TB, and malaria, as has been mentioned, the disruption of service in terms of access, in terms of people's confidence to go to the facilities, but also in terms of the community health workers who provide by far, big service and delivery, and not being able to actually do that either because of fear, but also because everybody was, afraid of the infection, and quite a number of us were also sick. And so inability to go to the facility to access that, but also the disruption and diversion of resources, of services to attend to COVID-19. As it is in the case of a health system crisis, every attention was really focused to controlling the epidemic, to the pandemic, to ensuring that we bring the infection under control. In terms of other areas that are very critical and that will actually yield long-lasting impact, include maternal health services, where because of lockdowns, a lot of the countries that are experiencing lockdown, there was difficulties in movement. You had pregnant mothers actually having complications because they couldn't make it to delivery in good time, transport being disrupted. But also when you think about child health, we have seen a dip in routine immunization, access to routine immunization. And we know that that is going to have far-reaching implications. So you have this number of under 5 children who did not receive all their injections. And if that is not corrected, or if that is not addressed to give them a catch-up plan, then you have quite a lot of people in the population who will later on be struggling with the fact that they missed their routine immunization. So you also have loss of livelihood. If you think about an economic impact, loss of livelihood with the lockdown, with a lot of businesses shutting. And what that means is that there are many families that still could not put food on the table. There are many people who could not afford their livelihood. And that also goes to say that when it comes to accessing healthcare services, especially in areas where out-of-pocket expenditure is the order of the day, where people do not have insurance, when you take away their employment, then you have people struggling to actually access and afford health services. The economic impact also, as we see it, also has the situation that we are now looking at in terms of a debt crisis. It has been mentioned before, but with the debt crisis, it means that a lot of our countries are still struggling to actually meet the needs of the population when it comes to providing health services, when it comes to investing in health services, when it comes to actually struggling with the prioritization of servicing their debts vis-a-vis investing in their health systems. And that's quite a big struggle. When you think about the long-term impact, you will have all these young girls and boys who missed almost 2 years of school. And as we know, with health system crisis or any kind of crisis, women and girls suffer the biggest burden. So you have girls who have missed about 2 years of school. And what that means in the future is lower employment. And if they cannot finish school, then you are looking at even possibilities of increased HIV infection, among other things, early pregnancies and all. We saw a rise in teenage pregnancies, actually. And so there are all those implications which will have far-reaching consequences in terms of the impact of COVID-19. So I'll leave it at that for now in terms of what we have seen. And I think around all that is the fact that the pandemic found fragile health systems and further made them even more fragile because of years of responding to other epidemics like HIV, TB, and malaria. And so with a weak health system, the pandemic has actually given that even a further dip. And I think this is a good moment for us to be talking about what does that mean going forward? How do we ensure that we recover? How do we do pandemic preparedness better going forward?
Thanks, Rosemary, for this, and also for bringing again the issue of the pandemic fatigue. Probably we are getting used to more hopefully relaxed way of dealing with the pandemic in Europe, but we should never forget that in some regions of the world this is not over at all, and the fact that some community-led services were suspended or diverted in order to because people could not even access basic services is something we should never forget when we discuss about this pandemic. And this is something that already occurred in the past, so we should avoid repeating the same mistakes. I would now like to give the floor to Professor Stefano Vella. I would suggest that you use this microphone because it works better for the online. So my question to you is, we know that COVID-19 was perceived as the very first pandemic because we all suffered and experienced same problems, and we were actually feeling to be connected in this unfortunate 2 years. But this is not the first one. So my question to you is, trying to bring a sort of historical perspective, what are the lessons learned that we can draw from other pandemics that already occurred in the past? I mean, we discussed about tuberculosis, HIV, malaria. So what are the lessons learned from the past, and how can we prepare, drawing on these lessons learned, to future pandemics?
First of all, thank you very much for inviting me here. I'm very honored to be part of this important panel. Yes, COVID is not the first global pandemic. We had many others, including the flu pandemic in 1918, which was a global pandemic with a new virus, actually. This virus was new for humans, and in fact, it killed 100 million people. But coming back to something that I know better is, for example, HIV/AIDS. I still remember what has been done to start the fight against HIV/AIDS maybe during the Durban conference. That was let's say, the starting point when we brought the conference to Durban, and Mandela was there, of course, and it made a difference. Then we went to the UN, and then the Global Fund was started. And we had, I mean, Tony Fauci wrote an article recently saying, hey, this is not the first pandemic, and there are lessons that we can learn from HIV response. So I deeply understand what our colleague from Africa said regarding the impact of COVID. Let me say under parentheses that COVID-19 is not over. And this is something we need to understand. And of course, now the number of cases decrease, but this happened every summer, so it's not new. And unfortunately, we see a few variants coming up. So what is the response? I mean, Fauci, in a sense, touched the issue of research, because I want to give a kind of little hope to all of us. First of all, research did work for COVID-19 until now, because the vaccines we have, they still work, but we need more. We need new ones. We need vaccines that covers the variants, that covers the infectivity, maybe that protects from long COVID, that it's also a problem. And I think that the development of vaccines has been fantastic, very quick, but still we need to understand that it's not something that happened by chance. I mean, work on RNA started, also on RNA vaccine started 14 years ago. So it's not new. This is something that because you touched about vaccine hesitancy, this is something that if we were enough good to explain to the people, that's not a miracle. That's a research issue. Of course, we need something new. We need the public being more strong in new vaccine development, because industry did a lot, but we know that the public investment has been incredible. So we need to really revisit this private-public relationship for the new wave of vaccines that may save us and the world. Of course, vaccine as equity is one of the issues that we tried to avoid with HIV in terms of drug equity, because we worked in bringing drugs, life-saving drugs, to low middle income countries. And that's what the Global Fund has done, not only for HIV, but also for TB and malaria, and we know that. But let me give a little hope again. We are far from the targets of 2030, but let's say that new things are coming, even from research in HIV, tuberculosis, and malaria. You know, by chance, the 3 poverty-related diseases are the only one that do not have a vaccine. I mean, you may say it's maybe by chance, but let me say that it makes you think why these 3 diseases do not have a vaccine, but still it's coming. We have a new malaria, it's not new, but we have a malaria vaccine that works for kids, yes. And then there's also TB vaccine coming. And all these vaccines actually come through public-private partnerships strong, where the public part is strong. I'm just making an example. It's also Ebola vaccine came in 2 years. So I'm pretty sure that also an HIV vaccine, because as I wrote in the Lancet in 2016, Marco, you remember, we will never end a global epidemic without a vaccine or a cure. And HIV is not an exception. So we need a vaccine also for HIV, and it's coming. It's coming because now we understood, and sorry, I'm speaking as a researcher, we understood why neutralizing antibodies against HIV are not produced by human, because HIV is very intelligent. He hides his epitopes. Now we know the antigen that induces neutralizing antibodies, and we are constructing trimers, we are constructing like a spike. We are constructing the same, like the HIV spike. And maybe through the mRNA technology, we will be able to have a vaccine for HIV, because it's definitely needed. Because this is why we need more funds for the Global Fund. Because, for example, a lot of people is not reached by the drugs that are available at very low cost. That has been an exceptional result obtained in 2002, when we went to Doha, in 2001, when there's been a kind of agreement on the use of generics. And the generics are saving lives, but they are not able to reach everyone, because there are some key populations in Africa that are unreachable. So we need, despite the fact that vaccines are available and the Global Fund is bringing them there, some populations are unreachable, and we need for them a vaccine. Let me come back to something that you touched. First of all, let me say that there are a lot of organizations working on the global health architectures, but they are not all the same. There's been a recent article, let's say, smoothly criticizing ACTAI in terms of saying that the governance is a little fluid. So not all the global health architecture institutions or organizations are the same. Some are more devoted to the public good, others to specific objectives. So we need to understand that we need to differentiate. The second issue is that I'm very happy if Italy would support again the Global Fund, because we have been great supporters of. I had also the honor of being member of the board when we were giving a lot of money, because Global Fund changed from the vertical. It's unfortunately Global Fund is still perceived as a vertical organization that works on diseases. It went horizontal, actually. So the best way to prepare us to respond to the actual pandemic and to prepare or be ready, because today I'm working a little bit for the G7. Now they talk about readiness, not preparedness. Now every G7 changed its objectives. So now it's pandemic readiness. So there is one way to be ready is, in fact, to do what the Global Fund is doing at the country level, at the basic level, at the public health level, at the health system level. This is indeed preparedness. We need to be prepared. We cannot reinvent things. This is my last issue. Do we need something new? I'm not sure. We really need something totally new. There are a lot of existing institutions. Let's differentiate and let them be strong. Maybe I'm very happy about the new task force. Hopefully we will put together, as Francesca said, health and finance, because they didn't talk before. But let's see. I look forward for them to, in a sense, harmonize the work of the others, which is one of the issues that actually took us unprepared. The lack of harmonization and of all these actors. Thank you very much, and thank you again from the IA, for whom I worked a lot on the T20 when we wrote this paper on the need for local production of goods, as it's now starting to happen. Let me say, just starting to happen.
Thanks a lot, Professor Vela, for this, and also for reminding that it's not over yet, despite of the claims that developed leaders from the developed countries are saying some regions are completely uncovered yet, or very much uncovered from vaccines, and they're still vulnerable because of the dependence on external supply chains and the lack of local capacity to manufacture vaccines, but also other important tools to tackle diseases and also endemics and pandemics, as we said. We are still waiting for Dr. Mohamed Abdulaziz to connect. So maybe in the meantime, we could also ask if there are questions from the audience in the room, but also from the audience connected. In that case, I would need to open the Q&A and the chat from our colleagues. But if we have already any reactions from the public, we are happy to give you the floor before getting to a second round of interventions from the panelists. Okay, so I see Valeria Farjon.
Thank you very much. And that is that so far, most of the attention concerning how we're handling the COVID pandemic in the least developed countries, and I'm focusing in particular on sub-Saharan Africa, most of the attention has been on preparedness, and it has been on the production, the manufacturing of vaccines in Africa. That's most of the attention. But if you go and look at the information produced by the CDC Center of the African Union, and I've been working on their data and producing maps for each individual country in sub-Saharan Africa, what you actually see is that the problem is not just what we're all talking about, that there are not enough vaccines that are getting to sub-Saharan Africa. But the real problem is that even if you get those vaccines there, in a number of countries, the vaccines they can actually administer are less than 50% of available vaccines. And this brings to the fore the issue of national public healthcare systems. That's the real weakness, the fact that national healthcare systems are unable to deliver. Simply because you just look at whatever indicator you want, number of doctors, number of nurses, available laboratories, whatever. There's weakness in those public healthcare systems. So my point is, isn't it time to start thinking that we should try to strengthen those public healthcare systems rather than keep talking about producing more vaccines? Yes, I can say probably it's a good idea to be able to produce those vaccines even in Africa, in Senegal or wherever. But that's not the crucial point. The crucial point is the weakness of public healthcare systems. I hope I've made my point clear. What I said is, even in summarizing the intervention of the European Union in a book recently published with a colleague of mine from the University of Montreal and originally from Niger, is that the EU has also forgotten about healthcare, because the only focus is on, even in the case of COVID, the focus is on the economic consequences of the pandemic, ignoring that there is a crucial issue about the strength of public healthcare systems. Not even in the case of Ebola was there reaction that these national healthcare systems need to be supported. That's my point, and I would be very happy to hear some reactions from the panel.
Okay. Thank you so much, Valeria, for this. Who would like to reply on the points raised by Valeria on the need to tackle the domestic weaknesses? I would say that one of the main issues that we are also facing is the way to support domestic resource mobilization. We know that these countries, many countries, will never be able to reach the financial resources domestically to tackle internal challenges, but they have also to mobilize internally these resources. So who wants to intervene from the panel on this? Françoise, I see you. Okay. And maybe also Francesca Manno. Yes, go ahead.
Thank you so much for the intervention. I think we could not agree more with what you said. And actually, one of the key lessons that we've learned through the response to COVID-19 is that among the most vulnerable low and middle income countries, the big difference was made by actually how much they had invested, and we had supported them in investing in their health systems. This is what has made the difference in their ability to respond or not to COVID-19 pandemic. So in other words, the areas of the health systems where investment had taken place before, whether human resources for health, data and information systems, supply chains, community systems, laboratory systems, all of those key health systems elements, the more we had been able to support them before the pandemic came, the more the countries were able to respond. Those very same infrastructure and capacities and capabilities created in our context to fight HTB and malaria were the ones mobilized to respond to COVID-19. So that was very clear. It's not about dumping tools on countries. That doesn't work. We cannot dump tools, even though they are very effective tools, if there is no one on the other end able to distribute, administrate, monitor, and so on and so forth. And if I may, I would just quote a colleague. Yesterday, we had a first day of the Global Fund board meeting. And a colleague from our board came from Ukraine, and he made a very strong statement saying, well, actually, if you want to build resilient health systems, and you have such a big crisis as a war, the infrastructure gets destroyed, the labs get destroyed, the hospital get destroyed, the roads get destroyed. But what makes the system resilient is people. Is actually the people on the ground who are still delivering treatment and prevention services and all of those things, despite the horrible situation as like a war. So it's about systems, and at the end of the day, it's about people.
I really don't have much to add of what Françoise has just said, but I also agree what the question and on how it's been described the situation. And we came to the realization of the fact that we actually concentrated too much on the procurement of vaccine and less on the way this vaccine could be delivered. And so now there is an increased awareness from all the organizations that work for ACTEI and also donors countries on the need to really provide resources for what will enable vaccine to be delivered and distributed. And certainly strengthening health system has been on our radars for so many years, and it's part of the preparedness agenda. But it's also an issue that has two components. One is certainly the domestic resource mobilization, domestic resources, which are sometimes not sufficient to do it. And others is that the support for the health system is really very fragmented in the present health architecture. So we have Gavi that gives a little bit, the Global Fund that gives another bit, and all this is not really coordinated in the right way. So I think that we all, I mean, with the COVID, realized that that's what we need to finance. How we will be doing in the future is still, I guess, to be discussed. Thanks.
If I can add or follow up on what I was asked in terms of lessons learned, for example, for the 3 diseases, what started in Africa is the decentralized models of care, which is exactly what didn't happen here. We were hospital-based. And in Africa, this decentralization of care in the hands of the patients themselves started very early because they had no hospitals, no doctors, no nurses. So the patients and the community, because you were talking about human capital, organized themselves and started to deliver. So that's a new, different way of thinking at strengthening health system, also strengthening the response from the community.
Rosemary, I see your hand raised, so you can also intervene.
Absolutely, thank you. I wanted to add the point that the last panelist has just mentioned in terms of when it comes to strengthening health systems, we will need to think about health systems that recognize the role of community systems. that recognize the role of community systems, just saying that the scenario we have where we now have supplies of vaccines, but the biggest challenge is to turn those vaccines into vaccinations. The delivery, the operationalization of that becomes very difficult, and community health workers can play a big role in terms of delivering that. We have to think about diversified strategies of delivering the vaccine. We have to think about mass campaigns, for example. It works in settings like this because it is also about the public perception, how people perceive the vaccines, how people perceive the science. And we rushed so much into getting the vaccine, which was very important, that we actually also forgot about the education component. So people could understand about the vaccine, about the science. There has been a lot of criticism about how the vaccine was found so quickly, and that builds to the dynamic we have on hesitation. Not sufficient confidence in it. And so we needed to invest in community engagement plans and mechanisms so we could explain to people very well, how did we arrive at that? What does this vaccine do? And that can help to boost confidence. And so community health systems that can meet people's needs and that recognize the role of community health systems, I think will go a long way. It is one of the lessons we learned from HIV, from TB, from malaria, about delivery of care at the community level. Thank you.
Thank you, Rosemary, for this, and also thanks, Professor Vela, for mentioning the need to have a people-centered approach and importance of decentralizing interventions to be more effective. Something that, as you said, we haven't learned too much from the past, and that but are definitely crucial. So now I would like to go back to the panels for a second round of interventions. But in the meantime, I invite all the participants to use the Q&A function to intervene in case they have questions or comments. We'll have more time later for Q&A. And I would like to go back to Françoise for the issue again of the pandemic preparedness. We know that there is work that it's been done at the level of the WHO and the World Health Assembly on this treaty or to handle future pandemics, and we know that it will take a lot of time to negotiate a document, but we know that from a regulatory point of view, this is something needed. What is the role of the Global Fund in contributing in defining pandemic preparedness strategies, both internationally at the level of multilateral fora, but also in dialogue, in the bilateral dialogue that you have with the recipient countries?
I think these were about 5 questions, right? Let me try. So first of all, what is a pandemic? It's interesting, right? Because when we are asked, what is the impact of the pandemic on the 3 diseases? Well, actually, TB is a pandemic as well. It's just that we had forgotten that it was a pandemic because perhaps it was not affecting rich countries anymore, right? So when we speak about pandemic preparedness, we need to be mindful of the fact that the world is still leading with a few pandemics, and more will come. So the reason why I'm saying that is that because I think to prepare for future pandemics, we need to deal with the current one. And this is why I was making the point earlier about investing in health systems, because investing in health systems that are inclusive, that include community systems, as Rosemary very compellingly explained, investing in health system will bring us triple dividend, actually, because it helps us address the old pandemics like HIV, TB, and malaria that are still around, respond to the new ones like COVID-19. As I explained, these are the same systems that have been responding so far, and prepare for the new ones. So let me give you one concrete example. If we were to prepare for, let's say, potential COVID-21, and we would be preparing by stockpiling some, I don't know, lab capacity machine, diagnostic machine somewhere in a warehouse, and that would be for preparedness. By the time the COVID-21 comes, those machines would be outdated, not working, etc. And in the meantime, nobody would have used them. So it's a loss of money. It's a loss of money. While if we invest in the current laboratory capacity, and those laboratory capacities are able to respond to COVID and HIV and TB and whatever else is happening in the country, then they are used like a muscle, right? And they are ready for whatever comes. So that makes the investment much more effective, less costly, and brings all of those dividends at the same time. So that's for us the very same point about we need to invest in health systems sort of now so that they can respond to old, new, and future threats. At the moment, the Global Fund is investing about 1/3 of its overall investment in health system strengthening. So that represents about $1.5 billion a year. And what we propose to do in the coming period, if we are successful with our replenishment and with raising at least $18 billion, which is our target, we should be able to invest even more. And our target is to invest 6, so 1/3 of those $18 billion in health system strengthening, building on the lessons that I've just explained. We really need to make sure that we integrate the different diseases. And why is that so? Because countries are going to face trade-off. They already face trade-off, right? Because they don't have enough resources. They have a huge fiscal pressure. The economic outlook for low and middle income countries is not great. So if we help them integrate diagnostics, for example, make it bidirectional, so that the same machine and the same lab technicians can screen for several diseases at the same time, it would be much more cost effective, and they won't have to choose. They can do both with the same investment. Similarly, community health workers, it makes no sense to have a community health worker trained to do malaria only or to do COVID-19 only. If we integrate that capacity, we'll be much more effective. So health system strengthening, integration to be more effective, equity and inclusivity. This is one of the things we've learned in this pandemic again, that actually in order to progress on the path towards global health security, we had to progress towards global health equity. And this is what we have not been so good at in the response to COVID-19. If we look at vaccination rates, the testing rates, and everything else around the world. So we need to make sure that the responses are, the pandemic preparedness efforts are built on the principle of equity and inclusivity with communities at the center, because without the communities, there's not much we can actually achieve, both in pandemic preparedness and in response. 2 more points. If we can avoid fragmenting the system further, that would be better. Because again, if you are a minister of health in the country, and you need to deal with the multiple actors that are already working in the global health space, and then you've got a few more that are going to deal with preparedness, it's not going to help you strengthen your health system. It's not going to help you integrate the different functions, because you will have all sorts of requirements and reportings, et cetera, et cetera. So the more we can build on the system, on the ecosystem, perhaps should I say, and strengthen the coordination, collaboration among the current global health actors, I think would really help. And last but not least, investment, because there is no secret, right? If we want to finish the fight against the old diseases, address the new ones, and prepare for the future, it's not going to be cheap. But this is the only way forward if we really want to, save lives and avoid future pandemics to be even more devastating than this one. So we need sustained investment in order to reach the 2030 Sustainable Development Targets. Stop there.
Thanks, Françoise. And speaking about investments, I would like to go back to Francesca Manno on the FIF, the Financial Intermediary Fund that was mentioned. How do you think the FIF could play, which role could it play to support investments in global public goods for preparing for future pandemics? We know that there is discussions ongoing on the architecture of the FIF. What, in your experience, could be the best recipe to make the FIF more effective in tackling future pandemic preparedness?
Yes, thank you. This is a tough question. We will be knowing only when we will finish our discussion, hopefully in the G20 or in the World Bank. But just for those who don't know what a FIF is, a Financial Intermediary Fund is basically a financial instrument that will leverage a variety of resources in support of global priorities. And a fifth for PPR the intention is to allocate additional and sustained financing through implementing partners towards critical function to strengthen PPR at national, regional, and global level. It's important that I want to underline through implementing partners, because this in a way address the important comment that Françoise was doing just a moment ago. We really strongly push for not having a new institution that would have had to the complexity and to the fragmentation. The idea of a fifth PPR is actually, on the contrary, to try to bring some coordination in the system and having a label for PPR, because as I say, the Global Fund, Gavi, others, the World Bank, for example, in the IDA 20 now is a huge allocation for PPR activities. But it's quite difficult for the countries exactly to understand where to go when they want to, address or finance PPR. So in principle, this facility should bring some coherence to the system, and they should, in principle, work on three main areas. Strengthen the country level capacity on the core domains that are listed in the international health regulations, such as surveillance, communication, and community engagement. Build regional and global level capacity dedicated to PPR entities, such as the one, for example, proposed by the African Union last October, which is modeled on the ERA, the EU Health Emergency Response Authorities. And activities also to elevate the PPR agenda, because this is also important. So technical assistance, peer learning, etc. What are the conditions that, at least in our view, will make this fifth successful? And many Françoise has already mentioned. And one is to add value to the system, complementing this institution like Global Fund and Gavi in this work, and ensuring the additionality of resources. Also, Rosemary was mentioning in the first intervention the fact that we should avoid distracting the resources that are devoted to other fights like malaria or HIV, tuberculosis for these issues. So they should be really adding value and be additional. The other things that I think you also mentioned was inclusiveness. So it will be a critical condition to ensure that the fifth will have legitimacy in the eyes of the low and middle income countries. And so we try to also bring a consensus on this facility with the WHO at its center, which is something different from traditional fifth hosted at the World Bank, where these organizations are usually not involved. And we strongly believe that any financial allocation from the fifth should come from a science-based and, someone that should tell us, finance minister or cooperation ministers, where should we put the money to be more effective. And so we really hope that we will manage. It's difficult because you want to be inclusive, but then you also want to give some steer to those who provide a huge amount of money. And also the amount of money is one important thing. The gap is more than 10 billion per year for the next 5 years. So these funds in principle should also be quite substantial to be effective. Otherwise, it's another small piece in the puzzle. Thank you.
Thanks a lot for this. And I mean, this will be an important tool. So it's important that now that we are in the phase of the designing of the architecture, we provide them with lessons learned from the past and also suggestions on how to make it more effective, knowing that it will take time and negotiations and discussions among the leaders. I would like to go back to Rosemary for another question that I have on the role of civil society. You are the perfect example and the best voice in this panel to tell us what role CSOs and local communities can play also in this process that will lead to the definition of pandemic preparedness plans. What is your experience in the levels of dialogue that we have had with national governments and even regional actors, and what is the role that CSOs should play in this process?
Thank you very much. So our main priority is to advocate towards the political will that is needed to achieve global health equity, either through better pandemic preparedness plans and also in terms of responding to the current diseases that we have right now. Like, we need to invest in those so we can better be prepared to fight whatever comes. And so I think one of the key messages in our work, in our advocacy, is around the fact that we need a global solidarity. We cannot have global health equity without the global solidarity. And that has come up a lot in terms of how the world actually needs to arise at a global level, at a regional level, even at the national level. Everyone needs to come together, and it takes political will to do that. And that's one of the things that we advocate for. Then in terms of responding, one of the other biggest messages from our end is around responding rapidly is very important. What we saw at the beginning of COVID is, for example, how the Global Fund responded rapidly by putting financial resources on the table to help mitigate the impact of COVID-19 on HIV, TB, malaria, as well as strengthen health systems, and that was very important. And we are looking right now, for example, the Act A and the financial requirement there that needs to be fulfilled. We are looking at the opportunity we have with the Global Fund 7th replenishment and the opportunity we have to make sure that that is successful, because it contributes to ensuring that not only do we respond to the existing diseases, HIV, TB, malaria, but it also contributes to strengthening health systems and helping us to better prepare for future pandemics. And then in terms of then in terms of how the process, we are very much keen to say that you cannot succeed in any global health fight or response without communities and civil society, as you know. So in our role to endeavor to create the political will that is needed, we have been very, I would say, vocal in saying that we need to ensure that not only are we engaging communities and civil society meaningfully in the processes where key decisions are being made, because we bring a unique perspective to that, but also when you have a global crisis and decisions have to be made at a global stage, it's important to also ensure that low and middle income countries are also meaningfully involved and engaged. We are talking about global health equity, and what COVID-19 has done is to actually uncover the depths of the inequity. And that is not just in terms of where vaccines are going or where tools are going. It is also how countries are coming to the table, how countries are being engaged when these conversations happen. There has been the conversation around vaccine, and this is important to say that initially there was a lot of those donations coming to the south, to low and middle income countries with very short shelf life. So that was an experience, and there has been a lot of advocacy from communities, from civil society to say, hey, this is not working. Now we are seeing that we are not seeing any delivery of vaccines that have less than 6 months shelf life, which is great. But supply is not enough. As we mentioned before, we have to think about how do we then make sure that you get the shot in the arm by putting together the different elements and things that needs to happen. And I think one of the biggest things, and Francoise, you mentioned this, is that how we can better invest. It's about investment, how we can better invest now in the diseases that we are tackling at the moment, HIV, TB, malaria, health systems, like had been mentioned earlier, how we can invest in those now and connect that to an integrated and comprehensive way of delivering health services. We are talking about how we can entrench, for example, the delivery of COVID-19 vaccines and how it can be integrated within routine immunization systems. We are talking about how can everything also be linked to primary health care, because it's really important, especially for low and middle income countries, that when we go to our primary health care entry points, we can actually access all the other services, prevention, tests, diagnostics, etc. So as civil society, as advocates, we are also very keen to work on accountability for the results that are being invested. And this is our commitment, to say that with the resources that are being invested, we are keen to make sure that at the country level, there's accountability where the resources are going, that they are going to actually meet the need. But also it's accountability about results, accountability about impact, that investments are coming into the country, but what results can we see? It's also accountability about our own government's domestic resource investment. So even as we are calling for international solidarity, we are calling for the world to unite, the G7, G20, everybody, but we are also speaking to our governments so that we can also step up our domestic resources, put it on the table. And that is the true sense of equity, the true sense of solidarity. And that's something that we need to work on in terms of sustainability. I thank you very much.
Thank you, Rosemary, and also for, again, recalling the role of domestic resource mobilization in this. Professor Vella, you spoke at the beginning of your intervention about the risk of panic and neglect. So we put a lot of energy on this pandemic, also on media. It's not over, but there is already in some regions the fear that there could be a panic and neglect process. What do you see as a major risk of a potential decrease of the political commitment in the fight against this pandemic that is not over yet, but also in the future ones?
Oh, yes, thank you for this question. Indeed, the neglect phase is already there, and it's not actually supported by the data because the circulation of the virus is very, and I would like to take this opportunity to, in a sense, cancel a kind of thinking that endemic doesn't mean harmless, because this is, malaria is endemic. It causes 600,000 deaths per year. Tuberculosis, as is an endemic disease, causes 1.5 million deaths, 1.5 million per year. And HIV is the same, 800,000 deaths. And in some places it's endemic. So I would like to, to say that it's not written anywhere that the virus becomes nicer. It's not written. Maybe in the 100 years evolution, yes, some organisms, microorganisms, become adapted to the, but these variants that are coming today, they look more transmissible, maybe less pathogenic, but we had less hospitalizations because there is a big coverage, at least in our country and in others, rich countries. So in a sense, it's not, it may not be real. And so in addition, we have new variants that we don't know. For example, the new BA.5 looks dangerous because it evades immunity. So we definitely need the new vaccines. And the neglect will increase because we will forget this in a sense. Now we have a catastrophe, which is the war, let me say, that also distract people. But I mean, we know why, because it's a catastrophe. And I would not take too much time, but remember the health consequences of a war are dramatic, always. All the wars brings with them catastrophic health emergencies, and Ukraine will not be an exception, both in-house, in their homes, and for refugees. We know we had a polio epidemic in Ukraine a few months ago. Polio that we even don't. I have here two people that works on polio eradication, and it's incredible. Africa is polio free. So we were able, maybe through the community, to bring polio vaccine in Africa. And now we have polio here again. So it would be a dramatic health crisis there. And I really congratulate the Global Fund, because they tripled their involvement in Ukraine in terms of funding for HIV mainly, because you know that there is Ukraine has the more cases of HIV infections than Botswana, of new HIV infections every year. So let's think a little, let's open our minds. And in terms of preparedness, people say, hey, okay, this was an exceptional circumstance, COVID-19. No, this is not a one-off event. We know that because, as you said, if we do not consider the One Health concept in our minds, we will have new pandemics, because, you know, there are studies that prove that there are millions of unknown viruses in the animals. We are talking about 1 million. Of course, not all of them will make this so-called spillover, but they are there. And so if we do not consider this equilibrium between our health, the animal health, both from wild and the environment, we will have a problem. So let's think that we are not alone in this world, and consider that some of the things that happens to us are because of us. We are the cause of some of the disasters that happens to humanity.
Thank you, Professor. We are heading towards the end, but I would like Vice Minister to also share a reaction. And I take the opportunity to also ask you, because it's been raised by the public, what are the plans of Italy now in the upcoming COVID summit that will be held on the 12th of May? Yeah, I'm always making big questions.
Yeah, it's clear that I'm not the minister to whom this answer, this question should be put, but I try to respond to give an answer. Yes, I wanted to react because I totally agree with the comments that I heard before. The lesson learned, first, that is the big one. There is no border which can stop a virus. And this is a very strong lesson, because we need global response to global challenges. The health is a global challenge, and we have to relaunch multilateralism. This is the first one, because it wasn't so clear before the COVID-19. And now I think it's clear, but as we have seen during the crisis in Ukraine, multilateralism is not always effective. So we need multilateralism, and we need effective multilateralism to face this global challenge that is health. Second lesson learned, that it was very clear in the previous contributions, we discovered that the health systems in low and middle income countries are very fragile. And the problem was, at the beginning, was the lack of vaccines, but it was very clear since the beginning that the problem was not only the availability of vaccines, but their capacity to deliver and to use them, to transform them in vaccination. And that is not only for these diseases, it's a general problem that we need to focus better also in our priorities in the international development cooperation. Health systems and the system of our partners in Africa or in other countries, of course, in other continents, they need to be strengthened and they need to be helped to strengthen. That means not only infrastructures, that means trainings, that means universities, that means many different fields of action. And in this framework, we need more fund, that is, we need to mobilize more fund, public fund and private ones, but also we need more effective tools. I want to underline what Francesca Manno, yes, Francesca said before. We do not need another tool. We need coordination, we need harmonization, but we need that all these tools could work together. Because I am a vice minister in Italy, but I can only imagine what happened in a low and middle income countries where they should talk with all these actors, and all of them are giving you something, but they are asking you something also. And it is very difficult to create the condition to work together. So we need, as international community and in the international fora, G20, G7, EU, and so on and so forth, we need to find a way to work together without asking our partners to have 10 different places where to discuss about health. And finally, I believe very much that it's very important the role of local communities, and this is true also for us. It was very clear which was the situation about COVID-19 pandemic when we talked with the NGOs. The Italian NGOs were very clear with us. COVAX facility is not working very well. Why? Because we need, of course, vaccines, but when they arrived, we do not know how to bring them to the beneficiaries, to the local communities, and so on and so forth. So they were very well, very prepared to understand which was the situation. And this is the reason why we have a small experience that I want to share with you. When we put money on the Global Fund, a percentage of the Global Fund resources, they are used to give to the NGOs some money for the last mile projects that are very important. It is very important to finance not only the very big projects, but also the small ones who are able to transform, for in this case, vaccine in vaccination, but also to create the condition, that is the small infrastructure, the preparation of people, local people for nurseries and so on and so forth. So I wanted just to underline the role of local communities and civil societies, not only in the countries who are in low income and middle income countries, but also in our countries.
Thank you so much for this, and also for reminding that this is a global problem. Yeah. You go ahead. Yeah.
I didn't want to shy the question that you mentioned before. Of course, from my point of view, we will work to confirm and to relaunch our commitment on the financial side, of course, for the replenishment, not only of the Global Fund, but all the instruments that we used in this we used to fund last year. It is clear that the point is not only on our agenda as Ministry of Foreign Affairs, but it is in the common agenda that we have with the Ministry of Finance. And I think that it's very important that also the G7, also the G20, they decide to keep our structure, no? But also the G7 is working on this side, and we will have the G20 Minister of Development meeting in 2 weeks in Berlin, and they will organize also a meeting with the ministers of health. So we will have a joint meeting, Ministry of Development and Ministries of Health. So I will G7. I said G7. No, in Berlin it was a G7 of course. Yes, and it is not G20. Thank you.
Which credit card do you use?
There.
Okay, thanks for this. As Francesca Manno said, and as you repeated, Vice Minister, indeed the issue is coordination and working together better to avoid duplication of efforts, and also ensuring a better and more effective use of resources. So I know this is not completely under your control, but it's always important that the development voice is fully taken into account in this process, because sometimes we know that bureaucracies speak different languages. So it's always good that the development, health, and financial perspective are put together in the same decision-making process, because that enriches the discussion and ensures better harmonization of resources allocated. We are heading towards the end of the meeting, so I really would like now to give Francesca the floor and the possibility to conclude the event. As I said, yeah, this is the panel is Francesca style in different languages, so it was not made on purpose, but it's very funny. But with Francesca, we have worked a lot in this year and also last year on G20, and I remember from last year with Francesca, we put already the emphasis of the One Health approach, meaning that also in that case, we were speaking about food security, but the issue of putting together all this polyphony of voices when decision makers and leaders gather is crucial. So the floor is yours for concluding this panel.
Thank you very much, Daniele, and thank you very much for the panelists for the incredible quality of the exchange between you. It was very, very interesting. I just wrote some words that are coming in all your intervention. One is harmonization, the other is participation, the other is coordination, and of course resources. In French, we say that is le nerf de la guerre. So it's important to have money to make this happen. And I would like just to give some of the recommendations that coming from the work that we did with EI. And one is a recommendation for the Italian government is really focused on the organization of the work around global health. Because I think that if COVID is not the first pandemic, COVID is the first pandemic that everybody realized that it was a pandemic, because one case in Wuhan can kill your grandmother in Bergamo. So everybody really realized that we are a community. And I think also that one of the words that have been very important in all our discussion, that we don't have to speak about spend in cooperation, but invest in cooperation. And we say we don't spend in humanitarian, we invest in global health, because investing in access to vaccine, health system strengthening, treatment, but also mask, doctors, nurses in low-income countries and middle-income countries is investment also for our health. Sometimes this can seem a little bit selfish, but if this can help to move forward on this issue, I think that is very important to leverage this issue. And so the first recommendation is a recommendation of coordination. So what we want to propose is to establish a permanent task force to include the finance, health, and foreign affairs ministry, as well as other relevant stakeholders, with the coordination that is hosted by the Prime Minister Office. And this, I think, that will be a very important space for coordinate the policy around global health, but also put at the top of the agenda. Global health is already at the top of the agenda, but I think that there is a big risk of panic and neglect. So I think that it's very important to capitalize on this moment, and also to try to make it happen, and also make it permanent for the future, to prepare and to prevent the future pandemic, but also to maintain this leadership role that Italy is building year after year on global health. Thank you also for thank you in particular for your work that you're doing on daily basis in your of different administration. And then I think that one of the very important things again around coordination and harmonization is the role that Italy can play at the G7 and the G20 level, and also in the board of the different multilateral actors where this sits, the importance of involvement or community or non-G20 countries and other key actors, because as you have seen is fundamental the role that the people that experience it on the field is on the development of the policy and also on the effectiveness of the policy, because sometimes we think that involve people is a sort of like, is good to involve, but is also efficient, is the best way to operate. And the third, of course, is the resources. So, I read an interview of the Vice Minister on the importance of relaunch the debate around the 0.7. Now that we are speaking about the 2% of the GDP for defense, I think also that it's very important to thinking about the 0.7 and relaunch the debate about this. Not because it's an old commitment that is something that we have to now more than ever is something that we have to invest, and maybe to thinking about a binding commitment as happened in other European countries with a trajectory that could be defined, of course, in partnership with the other administration, the parliament, to get the 0.7% this year. Italy get the 0.28, so have been the most important increase of the OECD countries, but I'm sure that more have been to done. And I think also that global health is a multidimensional issue, so maybe it's very important also to thinking about non-ODA resources for global health, in particular for research and development. And of course, it's important also to thinking about all the policy, all the spaces that are important to invest to lower the price of treatment and other medical devices and vaccine. So it's very important the role that Italy also can play in the negotiation around treatment pricing and vaccine pricing, in partnership, of course, of the other country of the European Commission. And then finally, I think also that is important to fund what work and also invest in the board also to improve the multilateral actors that where Italy already invests. I mean, Gavi, CEPI, the Global Fund, but I think that now more than ever is important to invest now to face the COVID pandemic. So of course that as Stefano said, now we have the impression that the cases are lowering, but in the autumn, in the fall, the cases will increase again. So it's very important to be prepared, but also prevent the future pandemic, and also find a response to those three terrible diseases that are HIV, TB, and malaria. So we have an investment case that asks for an increasing of the 30% of the investment in HIV, TB, and malaria. So I think that will be very important that Italy will have a proportional investment. And so I'm also today organized this event. Today is also very timely because tomorrow the Prime Minister will meet the presidents of the United States that this year will host the Global Fund replenishment. So again, I'm sure that the Global Fund and the global health will be at the agenda of the meeting of those two important leaders. So thank you very much. And thank you.
Thank you. Thank you, Francesca, for your remarks, for making this possible. And thank you for the participation of the panelists. Very high quality discussion, also virtually. Rosemary, I'm thinking about you. Next time we'll make sure they will be with us. We will keep working on these topics. We as researchers have a mission, being the watchdogs. As Professor Vella said, panic and neglect is not yet supported by the data. So we need to make sure that through the data, we support policymakers and other actors who are leading in this process that are making important decisions for the whole community. So I would like to thank you all for being with us virtually and physically on behalf of the Istituto Affari Internazionali, also Ettore for being with us today and opening this meeting. And last but not least, of course, the Vice Minister Sereni was with us for the whole meeting. We really appreciated that, and we will keep supporting you also in bringing your case in the decision-making tables when discussing about these topics. Thanks so much, and we will meet again soon in future events.